St. Catherine's emergency department sits quiet in the pre-dawn hours, wrapped in that particular shade of blue that comes just before sunrise. Fluorescent lights hum overhead, casting their sterile glow across linoleum floors still damp from the night custodian's mop. The air carries the sharp bite of disinfectant mixed with something else. Burnt coffee, 3 hours past drinkable, congealing in a pot no one bothers to refresh. This is the dead zone. 4:30 in the morning. Too late for bar fights, too early for heart attacks. Dr. Maya Reeves stands in the supply closet, counting suture kits. Her hands move with mechanical precision, checking inventory against the clipboard in her other hand. 34 years old, emergency physician. 2 years at St. Catherine's. Currently organizing shelves that were already organized yesterday. She doesn't look up when Nurse Jacobs passes by, coffee in hand. Dismissive glance thrown over her shoulder. Maya, when you're done playing house, Bay 3 needs a discharge summary. Elderly gentleman, simple UTI, should be right up your alley. Maya continues counting. 4-0 silk, 3-0 nylon, absorbable subcuticular. She used to respond to comments like that. Used to defend herself, explain, justify. She learned it doesn't matter. Words don't change minds, only results do, and even then, not always. The conference room 3 days ago. Mahogany table. 7 board members on one side, Maya on the other. Dr. Henderson, chief of medicine, addressing the room with practiced authority. Dr. Reeves handles routine cases quite competently, but trauma leadership requires a certain temperament, a particular kind of fortitude under extreme pressure. Board member Sullivan, late 50s, wire-rimmed glasses. We've discussed this at length. There are concerns about emotional resilience. High-intensity trauma situations demand split-second decisions, often brutal ones. You understand our position. Dr. Marcus Loomis, trauma director, leaning back in his chair with the confidence of someone who's never been questioned. No offense, Maya, but battlefield medicine isn't something you learn from textbooks. It's instinct, aggression even, the ability to make hard calls without hesitation. Maya's face remained neutral throughout, hands folded on the table, professional. I understand. The vote was 7-2. Dr. Marcus Webb received the trauma lead position. 29 years old, 6 months in emergency medicine, but confident, assertive, and male. In the supply closet, Maya lifts a box of IV starter kits, repositioning it on the upper shelf. Her thumb traces across her left wrist as she lowers her arm, finding the small scar there, faded now. Thin white line against tan skin. Surgical precision. She tells herself it doesn't matter. She's here to work, to help people. That's enough. The trauma bay doors swing open an hour later. Ambulance radio crackles to life. Dispatcher's voice cutting through the quiet. St. Catherine's, we have incoming. MVA rollover, 26-year-old male, GCS 10, suspected internal bleeding. Blood pressure's trending down. ETA 4 minutes. Dr. Webb appears from the physician's lounge, snapping on gloves with theatrical efficiency. My case. Reeves, you can observe if you want. Might learn something. Maya stands near the wall, arms loose at her sides, eyes tracking the monitor being wheeled into position. The doors burst inward. Paramedics rush through with practiced urgency, rattling off vitals as they transfer the patient to the trauma bay gurney. BP's dropping, 80/50 now. Heart rate 142, tachycardic and deteriorating. Chest contusion visible, suspected rib fractures on the left side. Webb moves to the patient's side, hands already palpating the abdomen. The young man screams. Am's body arching against the restraints. Okay, we need a fast scan immediately. Get me 2 large bore IVs. Type and cross-match for 4 units of O negative. Move, people. The ultrasound tech fumbles with the machine. 15 seconds tick by. 20. Maya's eyes never leave the monitor. Heart rate climbing. 155, 162. Blood pressure sliding downward. 78/48. She sees it. The way his abdomen distends slightly on the left side. The guarding, the rebound tenderness Webb's aggressive palpation triggered. Left upper quadrant, splenic rupture. He's bleeding into his peritoneal cavity, and every second spent waiting is another 100 milliliters lost. She takes 1 step forward. He needs surgery, now. Webb doesn't look up, focused on the ultrasound screen, finally flickering to life. I'm aware, Reeves. We follow protocol. Confirm, then act. A monitor alarm begins its insistent beeping. Blood pressure, 70/45. He doesn't have time for protocol. Webb's voice sharpens, an edge of irritation cutting through his concentration. I said I'm handling it. If you can't observe without commentary, you can leave. Maya steps back, jaw tight, hands clasped behind her back, thumb pressing hard into that scar on her wrist. 2 minutes later, the surgical team arrives, already gowned. The patient is rushed toward the operating room. Blood products hanging from IV poles, anesthesiologist bagging him manually as they move. Wed strips off his gloves, exhales heavily, runs a hand through his hair. Close call. Good thing I caught that splenic rupture before he crashed completely. Nurse Jacobs nods, making notes in the chart. Excellent work, doctor. Maya walks past them toward the locker room. She says nothing. Inside, she sits on the wooden bench, staring at her locker door. Opens it slowly. White coat hanging neatly. Stethoscope coiled on the hook. And there, tucked into the back corner where no one else would notice, a folded patch. Tan fabric, faded from years. An eagle and anchor, edges frayed with age and handling. She keeps it there. A reminder of who she was, and who she can never be again. Her eyes drift closed. Just for a moment, she's somewhere else. Somewhere hot and loud and desperate. Then she opens them, closes the locker. Returns to work. Morning rounds begin at 7. Sunlight slants through the eastern windows, painting the corridor in amber and gold. Night shift personnel trudge toward the exit, replaced by day shift staff arriving with travel mugs and determined expressions. Maya reviews patient charts at the nurse's station, pen moving across paper with methodical efficiency. Routine notes, discharge instructions, follow-up recommendations. Doctor. Wed passes with 3 residents trailing behind him like ducklings following their mother. His voice carries, deliberately loud, pedagogical. And that's precisely why you don't wait for imaging when clinical presentation is obvious. Trust your instincts, people. Medicine is as much art as science. The residents nod eagerly, scribbling in their notebooks. Maya's pen stops moving for just a fraction of a second, then continues. The trauma bay doors open at 9:47. Paramedics wheel in a stretcher, moving fast, their radio chatter preceding them. 42-year-old female, construction accident, crush injury to right leg, significant blood loss at the scene, tourniquet applied 18 minutes ago. Maya glances up from her charting. The woman's leg, mangled metal and tissue, tourniquet cinched high on the thigh, fabric dark with absorbed blood. Below the knee, the skin has taken on a purple-blue tint, mottled, no perfusion. Maya's breath catches in her throat. The room shifts. Walls dissolve into canvas. Fluorescent lights become desert. Cert sun filtering through tent fabric. The disinfectant smell turns to copper and dust and burning fuel. A young Marine on a stretcher, 19 years old, leg nearly severed at mid-thigh, femoral artery spurting with each heartbeat, blood spraying across her surgical gown in rhythmic pulses. Her own voice, younger than, hoarse from screaming orders over mortar fire. Stay with me, Rodriguez, eyes on me. Don't you dare look down. Her hands moving without thought. Clamp, tie, pressure, his pulse under her fingers, rapid and thready, fading with each passing second despite everything she's doing. Doc, I can't feel my leg. That's okay, that's normal, just keep breathing. The explosion outside, tent walls rippling, dust raining from the ceiling, her body covering his instinctively, protecting him from debris while her hands never stop working. His pulse, still there, weak but present. Jacobs, Maya? She blinks. The trauma bay returns. Nurse Jacobs standing beside her, concern creasing her forehead. You okay? You looked like you were somewhere else. Maya straightens, forces her shoulders to relax. Fine, just tired. She watches Dr. Wed examine the construction worker, his hands probing the tourniquet site with clinical detachment. Orthopedics is on the way up. We'll maintain the tourniquet until they can assess in the OR. The patient's blood pressure reads 85/50 on the monitor. Maya moves closer, unable to stop herself. That tourniquet's been on for 23 minutes now. Tissue necrosis begins at 30. Webb doesn't look at her. Ortho will handle it when they arrive. She'll lose the leg if we wait that long. His irritation is palpable now, voice tight with constrained frustration. Reads, I'm not performing vascular surgery in the emergency department. We have protocols for a reason. Maya reaches for the woman's ankle, checking for a distal pulse. Her fingers press against cold skin. Nothing. No pulse, no perfusion. The limb is dying in real time. There's no distal pulse. The tissue is already compromised. Wed finally turns to face her, jaw set. Then it's already too late. We stabilize her systenically, and let the specialists make the call. Maya's hands ball into fists behind her back. Her right thumb finds that scar on her left wrist, pressing down hard enough to leave a white mark. In another life, she would have taken control, would have released the tourniquet, clamped the bleeder proximal and distal, restored flow, given the limb a chance. She's done it before, in conditions far worse than this pristine American emergency room. But that was another life, another name. She steps back, says nothing more. 20 minutes later, she walks through the hallway toward the staff break room, her steps controlled and even. Years of training keeping her spine straight and her pace measured. Leon sits near the staff entrance, the older security guard who's been here longer than most of the medical staff. Former military, judging by the posture he maintains even while seated. He's reading a worn paperback, but his eyes lift as she approaches. He watches her walk, really watches. Then his eyes narrow, and something shifts in his expression. "Doc Reeves?" Maya stops, turns slightly. "Yes? Can I ask you something? You ever serve?" The question hangs in the air between them. Maya's face reveals nothing, a practiced neutrality she's perfected over 6 years. "Why do you ask?" Leon sets down his book, taps his chest twice. "Army, 2 tours in Iraq. You learn to recognize certain things, the way someone moves, checks exits when they enter a room, stands with their weight distributed just so." He pauses, studying her. "You got the look, Doc. Just wondering if I was right." Maya's smile is polite, distant, perfectly calibrated. It to deflect without offending. "I'm just observant by nature. Medical training, I suppose." She continues toward the break room. Leon watches her gun, unconvinced, frowning slightly. He picks up his book, but doesn't read it. "Yeah," he mutters to the empty hallway, observant. In the break room, Maya pours coffee with steady hands. Then her fingers betray her, trembling just enough to make the liquid shimmer in the cup. She sets the pot down carefully, breathes in through her nose, out through her mouth, 4 counts in, 6 counts out. The breathing technique they taught her in therapy back when she first got out. She tells herself she's moved on, that the past stays where she buried it, that Maya Reeves is who she is now, not who she used to be. But the body remembers what the mind tries to forget. Muscle memory doesn't care about new identities or fresh starts. Her reflection stares back at her from the microwave's black glass door. For just a moment, she sees someone else looking out. Tan uniform, dust smeared across her cheekbones, blood dried under her fingernails, eyes harder than they are now. She blinks. Just Maya again. Just a doctor. Just someone trying to do good work in a quiet life. She drinks her coffee, returns to her charts. The day continues. Afternoon settles over St. Catherine's with deceptive calm. 2:13 reads the clock above the nurse's station. 6 patients in the waiting area, none critical. 3 discharges pending. Standard Tuesday afternoon in a level 2 trauma center. Maya sutures a laceration on a teenager's forearm. Her stitches neat and evenly spaced, each one precisely placed. The boy watches her work with fascination. "You're really good at that." Maya glances up, offers a small smile. "Practice, lots of practice." "How many stitches have you done?" She considers the question. "Too many to count. In sterile rooms and dusty tents and the back of moving vehicles. Enough that my hands know what to do without thinking about it." The distant wail of sirens cuts through the afternoon quiet. Multiple vehicles, approaching fast. The sound grows louder, more urgent. The overhead PA system crackles to life. "Trauma alert. Mass casualty incident. Highway 40. Multi-vehicle pileup. Multiple critical patients incoming. ETA 2 minutes. All available personnel report to trauma immediately." Maya's head snaps up. Her hands complete the final stitch automatically. Tie it off. Snip the thread. "You're all set. Keep it dry for 48 hours. She's already moving toward the trauma bay. Staff members converge from all directions. Webb stands at the center of the organized chaos, assigning roles, his voice projecting confidence. "Listen up, people. We triage in the bay. Critical patients go straight to OR. Greens and yellows overflow to the observation unit. Stay sharp, stay focused." The doors explode inward. 4 gurneys, blood everywhere, screaming. The organized chaos instantly tips toward just chaos. The first paramedic's voice cuts through. 24-year-old male, ejected from vehicle, severe head trauma, GCS 6, pupils unequal. Second paramedic, overlapping, 32-year-old female, pregnant, 32 weeks gestation, blunt abdominal trauma, fetal heart tones dropping. Third, elderly male, 71, chest pain radiating to left arm, possible MI, ST elevation on field EKG. Fourth, child, 8 years old, unresponsive, suspected internal injuries, found 20 feet from vehicle. Webb freezes. Just for a second, but Maya sees it. The moment when the volume of crisis overwhelms the capacity to process. Okay, Jacobs, take the pregnant patient to OR. No, wait, we need OB to assess first. Get them down here. Someone page cardiology for the elderly gentleman. Alarms begin screaming. Multiple monitors. Worse, multiple patients. A cacophony of electronic warnings that all mean the same thing. Someone is dying. The child's monitor flatlines. The high-pitched whine of asystole. A nurse's voice rises in panic. Doctor, the kid's crashing. No pulse. Webb spins toward the sound, his composure fracturing. Start compressions. Get me epi. 1 milligram. Maya stands at the periphery, watching. Her eyes move across the room, taking in everything. 4 patients. 3 critical. 1 team. 0 margin for error. The child's mother somewhere outside, held back by security, her screaming audible even through the closed doors. Maya's voice cuts through the chaos like a blade, calm and absolute. Stop. Everyone freezes. The word carries authority that can't be questioned. Maya steps forward, moving to the child's bedside. He's not in asystole. The lead's disconnected. She reaches down, reconnects the electrode. The monitor beeps. Weak, irregular, but present. Her voice shifts into something else entirely. Command mode. No hesitation. No consultation. He's in hypovolemic shock, likely splenic or hepatic laceration. Webb, you take the head trauma patient. He needs definitive airway control in the next 3 minutes or he'll herniate. Jacobs, get the pregnant woman to OB stat. Don't wait for them to come down. Every minute counts for that fetus. She points at Leon, who's just entered to help with crowd control. Get the elderly male to cardiology now. Possible STEMI. He needs a cath lab, not a trauma bay. I'll stabilize the child. Webb stares at her, stunned into momentary silence. Reeves, you can't just take over. Maya's eyes meet his. Something in her gaze makes him stop talking. You want to debate chain of command, or you want these people to live? Silence. 1 second. 2. Webb's voice comes out quiet. Do it. Maya moves. Her hands fly with practiced precision. IV lines placed in seconds. Ultrasound probe on the child's abdomen, her eyes reading the screen with instant comprehension. Free fluid in Morrison's pouch. He's bleeding into his abdomen. 2 units O negative. Now, prep for exploratory laparotomy. A nurse hesitates. We don't have surgical authorization. Then we do it here. She grabs a scalpel from the instrument tray, doesn't wait for permission or protocol. Betadine splashed across the small abdomen, in broad strokes. Bag him. Keep oxygen saturation above 90. The blade moves. 1 clean incision. Subcutaneous tissue parts. Fascia. Peritoneum. Blood wells up, dark and venous. Suction. Her hand reaches into the abdomen, finds the source. Splenic laceration, grade 3. Actively bleeding. Clamp. The instrument slats into her palm. She places it with absolute certainty. The bleeding stops. Her face shows nothing. No fear, no doubt, just focus. She ties off the vessel, packs the abdomen with surgical sponges, begins closing the fascia in layers. Get him to OR for formal repair. He's stable enough for transport now. She steps back. Blood soaks her gown, her gloves, her shoes. The trauma bay has gone silent. Everyone staring. The child's monitor shows improvement. Blood pressure rising. 85/50, 90/55. Heart rate stabilizing. Webb stands frozen. The head trauma patient now intubated and stable beside him. His voice comes out barely above a whisper. Where the hell did you learn to do that? Maya strips off her gloves without answering, drops them in the biohazard bin. Her hands are steady now, completely steady. She walks toward the scrub sink without a word. 10 minutes later, she stands in the hallway, washing her hands under scalding water. The mechanical motion. Soap, rinse, repeat. Leon approaches slowly, recognition written across his face. That wasn't medical school, Doc. Maya's hands. Pause under the stream. That was field surgery. Combat medicine, I've seen it before. In Ramadi, Fallujah. She turns off the water, reaches for paper towels. Leon's voice softens. That kid's alive because of you. Maya meets his eyes. For a moment, the mask slips. Just slightly. He's alive because someone did what was necessary. Leon nods slowly. Yeah, someone who knew exactly what they were doing. He straightens, stands at something close to attention. Thank you for your service. Doc, Maya's face cracks. Just for a second. Then she's walking away, down the corridor, back straight, steps measured. But her hands are shaking again. Behind her, the whispers begin, spreading through the department like ripples in water. Who is she? Where did she train? How did she know? Maya doesn't hear them. She's already gone. 4:45 in the afternoon. Golden light streams through western windows, softer now after the storm of the past hours. The patients have been stabilized. The pregnant woman delivered safely via emergency cesarean. Healthy boy, 32 weeks, small but breathing. The child from the pileup is in the ICU, vitals holding steady, prognosis cautiously optimistic. Maya sits alone in the staff lounge. A cup of coffee grows cold between her hands. She stares at nothing, her eyes focused somewhere beyond the walls, beyond this building, beyond this life she's carefully constructed. The door opens. A man enters, late 40s, expensive suit, confident stride that speaks of authority earned and wielded. Assistant Director of Hospital Operations, Garrett Mills. Dr. Reeves? Maya looks up slowly, returning from wherever her mind had drifted. Yes? Mills steps closer, his expression one of genuine respect. I wanted to personally commend you on your actions today. That child's parents are asking to meet you, to thank you. Maya shakes her head. Not necessary. You saved his life, performed emergency surgery in a trauma bay. That's extraordinary. I did what needed to be done. Mills studies her, curiosity sharpening his gaze. You've been on staff here for 2 years. No one's ever seen you do anything remotely like that. Where exactly did you train? Hopkins, Standard Emergency Medicine Residency. Hopkins doesn't teach field laparotomies on pediatric patients without surgical backup. Maya's jaw tightens. She sets down the coffee cup, preparing to deflect, to redirect, to maintain the careful walls she's built around her past. Before she can speak, the door bursts open. A man in full naval uniform, commander rank insignia on his shoulders, late 50s, weathered face marked by sun and experience. He moves with urgent purpose. Is there a Dr. Maya Reeves on staff here? Mills turns. Right here, who are you, and how did you get past security? The commander ignores him entirely, his eyes locking onto Maya with laser focus. Dr. Reeves, we have a critical situation. The governor's motorcade was ambushed 15 minutes ago. Gunshot wound to the chest. He's being transported here now because we're the closest level 2 trauma center. We need your best trauma surgeon ready too. He stops mid-sentence. His face changes completely. Recognition hits like a physical blow. The word comes out as barely a whisper. Reyes, Maya's entire body goes rigid. The coffee cup slips from suddenly nerveless fingers, hits the floor. Doesn't shatter, just rolls in a slow arc across the linoleum. That name. She hasn't heard it spoken aloud in 6 years. The name she buried with her uniform, her medals, her past. Reyes, her birth name. The one she left behind when she walked away from everything. The commander steps closer, his eyes wide with disbelief. Lieutenant Commander Maya Reyes, Medical Corps, Forward Surgical Team Bravo. Kandahar Province. Mills. Mills looks between them, confusion deepening. I'm sorry, there must be some mistake. This is Dr. Maya Reeves. She's been on our staff. The commander's voice cuts through, certain and unwavering. It's not a mistake. He stands at attention, salutes with crisp precision. Ma'am. Maya can't move, can't breathe. The room feels too small, the walls pressing in. Commander, I think you have the wrong person. Kandahar, 2017. FOB Chapman, you performed an emergency thoracotomy on Lieutenant Mills during a mortar attack. Cracked his chest right there in the field hospital while the compound was taking fire. I was there. I held the retractor while you worked. His voice carries absolute certainty. I watched you save his life with your bare hands while the roof was coming down around us. Silence stretches like wire pulled taut. Mills stares, his face pale. Lieutenant Commander? Your military? The commander never looks away from Maya. She was one of the finest combat surgeons in theater. Saved over 200 lives across 3 deployments. Recommended for the Navy Cross after the Chapman incident. Maya's breathing has gone shallow, rapid. Her hands tremble. I'm not that person anymore. The commander's expression softens, but his voice remains urgent. Ma'am, with all due respect, the governor of this state just arrived at our ambulance bay with a gunshot wound to the chest. Assassination attempt. He's critical. Our nearest military surgical team is 40 minutes out by helicopter. He takes another step forward. We need you. He needs you. Maya shakes her head, backing away. I can't. I don't do that work anymore. I left that behind. He's dying. The words hang between them. The commander's voice drops, becomes almost pleading. Please, Commander. People are counting on you. Maya's hands shake violently now. She looks at Mills, seeing the shock and confusion written across his face. Then back at the commander. Then at the door. For 6 years she's run from this. From the weight of other people's lives in her hands. From the impossible choices. From the woman who could open a human chest cavity and keep working while mortar shook the ground beneath her feet. She closes her eyes, breathes. The 4-count technique fails her now. Opens them. Where is he? The hallway becomes a blur of motion. Maya walks fast, the commander keeping pace beside her, falling back into the rhythm of military briefing without conscious thought. GSW just below the left clavicle. Single entry wound, no exit. Hypotensive on scene. Tachycardic, likely hemothorax. Possible vascular injury. EMS got 2 large-bore IVs en route. OR availability? Prepped and standing by. Anesthesia is ready. They round a corner into a crowd. Hospital administration. Local police. State police. Secret Service agents in dark suits speaking into wrist microphones. Dr. Webb stands at the center, talking to a senior agent, his voice carrying stress and uncertainty. We're doing everything we can, but he needs a specialized trauma surgeon. Our best is currently in another surgery. We're trying to get someone from County General. The commander's voice cuts through like a foghorn. You have one right here. Everyone turns. Webb sees Maya. His expression shifts to disbelief, bordering on contempt. Reeves? This is the governor of the state. We need someone with actual trauma experience, not an ER physician who got lucky with a kid. She has more trauma experience than everyone in this building combined. Webb scoffs. She's an emergency room doctor with a residency. She's a combat surgeon, United States Navy, 8 years of service. 3 combat deployments. Forward surgical team operating in active war zones. The hallway goes silent. Every eye turns to Maya. She stands. Ends there, small in her blood-stained scrubs, exhausted, exposed. The senior Secret Service agent steps forward, his voice clipped and professional. Can you save him? Maya meets his gaze, holds it. I can try. The agent nods once. Decision made. Or 2. Now, you have full authorization. Maya moves toward the surgical wing. Webb grabs her arm, his grip tight, his voice low and angry. You lied. About everything. About who you are. Maya looks down at his hand on her arm, then up at his face. Her voice comes out quiet, cold, absolutely certain. Let go. He releases her. She walks away, toward the operating room, toward the dying governor, toward the person she swore she'd never be again. Behind her, the whispers explode into open conversation, questions flying. Who is she? Navy surgeon? Combat veteran? How did we not know? Maya doesn't hear any of it. Her mind has already shifted into surgical mode, reviewing anatomy, anticipating complications. Preparing for battle. Some things you never forget. Some things live in your hands forever. Operating room 2. Sterile white walls. Bright surgical lights casting no shadows. The governor lies on the table, barely conscious, his face gray with blood loss. Monitors beep with increasing urgency. His name is Robert Kincaid, 58 years old, father of 3, governor for 6 years. Right now, none of that matters. Right now, he's just a body. Bleeding. Dying. Maya stands at the scrub sink, visible through the window into the OR. Her movements are methodical, automatic. Soap, scrub, rinse. The ritual older than memory. Inside the operating room, nurses prep the surgical field. The anesthesiologist hooks up monitoring lines with practiced efficiency. Dr. Webb stands outside the OR, arms crossed, watching through the observation window. His face is unreadable. anger, curiosity, disbelief, all mixed together. Maya takes one long breath, pushes through the door. The temperature drops immediately, the air conditioning keeping the room at precisely 64 degrees. She approaches the table, eyes already assessing. The governor's chest rises and falls in shallow, labored movements. His skin has taken on a waxy quality. Status. The anesthesiologist doesn't look up from his equipment. Blood pressure 70/40. Heart rate 140. Oxygen saturation 88% and dropping. He won't last much longer. Keep him under light sedation. I need him stable enough to operate. Maya examines the wound. Small entrance just below the left clavicle. Dark blood pools in the hollow of his throat. No exit wound visible. The bullet is still inside. Scalpel. The scrubbed nurse places the instrument in her palm. Cold steel. Familiar weight. Maya's hand is completely steady now. The trembling from earlier has vanished, burned away by focus. She cuts. One clean incision through skin, through subcutaneous tissue, through muscle. Her movements are efficient. No wasted motion. Every action serving purpose. Retractor. The wound opens under her hands. Blood wells up immediately, dark and pulsing. Suction. The nurse complies. Maya reaches into the chest cavity, her fingers reading anatomy through touch. There, the subclavian artery, torn, leaking with each heartbeat. Bullet nicked the subclavian. Vascular clamp. Clamp appears in her hand. She places it with absolute precision. The bleeding slows to a trickle. 4-0 proline suture. I'm repairing the vessel wall. Her hands move with impossible speed and accuracy. Needle through tissue. Pull. Tie. Cut. Again. Again. The rhythm she's performed hundreds of times in conditions far worse than this pristine American operating room. Intense with canvas walls. In buildings with half the roof missing. In the back of moving vehicles on unpaved roads. This is easy. See, by comparison, this is simple. 5 minutes pass. Might as well be 5 seconds. Release the clamp. The nurse releases it slowly. No bleeding. The repair holds. Good. Chest tube for drainage. She places the tube with the same efficient precision, threading it between ribs, positioning it to drain the accumulated blood from the pleural space. Start closing. Layer by layer, she reconstructs what she opened. Muscle, fascia, subcutaneous tissue, skin. Each suture placed with care. The monitor shows improvement. Blood pressure 95/60. Heart rate 110. Oxygen saturation climbing back toward normal ranges. The anesthesiologist's voice carries relief. He's stabilizing. Maya finishes the final suture, steps back, strips off her gloves with sharp snaps. Post-op ICU. Monitor closely for infection and hemorrhage. Chest X-ray in 2 hours to confirm tube placement. She turns toward the door. Commander Halford enters as she's leaving, his face tight with concern. How is he? He'll live. Barring complications, full recovery expected. Halford exhales, his shoulders dropping. Thank you, Commander. Maya doesn't respond. Walks past him into the hallway. A crowd has gathered outside the OR. Hospital staff, police officers, press visible through the windows at the end of the corridor. Cameras and lights and shouted questions. Maya stops, seeing them all staring. The weight of their attention feels physical. Doctor. Webb steps forward, his voice tight and controlled. So, you're a decorated war hero. Congratulations on finally revealing yourself. I'm not a hero. You let us all believe you were just some ordinary ER physician. I am an ER physician. Webb's voice rises slightly. You lied to us, to the board, to everyone. Maya's eyes flash, the first real emotion breaking through her controlled exterior. I didn't lie. I simply didn't advertise who I used to be. Didn't advertise? You hid a military career, combat experience, skills that this hospital desperately needed. I left that life behind. Her voice drops, becomes almost pleading. I wanted to practice medicine without the war, without constant death. I just wanted to help people in a normal way. Webb shakes his head. And you thought concealing your qualifications was appropriate? I thought being Maya Reeves would be enough. She looks around at the assembled crowd, at the faces staring at her with mixtures of awe and suspicion and curiosity. I was wrong. She turns and walks toward the exit, her steps steady despite the exhaustion pulling at her bones. The parking lot sits quiet under early evening sky, streetlights beginning to glow. Maya reaches her car, an older sedan, nothing remarkable. She sits behind the wheel without starting the engine, hands gripping the steering wheel, knuckles white. Her phone buzzes, text from an unknown number. This is Admiral Patricia Corrigan, Navy Medical Corps. We need to talk. Please call at your earliest convenience. Maya stares at the message for a long moment, then deletes it. She starts the car. The engine turns over with a familiar rattle. She pulls out of the parking lot, heading toward her apartment, toward another sleepless night, toward a life that will never be the same again. The secret is out. The mask has been torn away. Maya Reyes has been dragged back into the light, whether she wants it or not. Inside the hospital, the whispers continue. Staff members huddle in break rooms, exchanging stories, filling in gaps with speculation. By tomorrow, everyone will know. By next week, the press will have found her deployment records, her commendations, her citation for the Navy Cross she never accepted. The woman who wanted to disappear has become impossible to ignore. Maya drives through the city, traffic lights blurring. Past, her mind already playing through worst-case scenarios. She knows what comes next. The attention, the questions, the demands that she explain herself, justify herself, perform her trauma for public consumption. She parks in her apartment complex, sits in the car for another 5 minutes, before finding the energy to move. Some doors once opened can never be closed again. Some truths once spoken can never be taken back. Maya walks to her apartment, unlocks the door, steps into the darkness, doesn't turn on the lights, just stands there in the quiet, feeling the weight of the day pressing down. Tomorrow, everything changes. Tonight, she allows herself this moment of grief for the life she's losing. The anonymous life, the quiet life, the life where she was just Maya Reeves, ER physician, nobody special. That woman is gone now. In her place stands someone she thought she'd buried 6 years ago. Lieutenant Commander Maya Reyes, combat surgeon, the woman who couldn't walk away when people were dying. Not then, not now, maybe not ever. Maya's apartment sits dark and quiet. 11:47 at night. The city hums outside her window, distant traffic and sirens, and the ambient noise of life continuing, while hers feels suspended. She sits on the edge of her bed, still wearing the scrubs from the hospital. They smell like betadine and blood and surgical soap. She hasn't showered, hasn't eaten, just sits, staring at the wall, mind replaying the day on an endless loop. Her phone rings. She ignores it. It rings again and again. On the 4th attempt, she finally picks up. Hello. The voice on the other end is female, firm, carrying the unmistakable authority of high rank. Lieutenant Commander Reyes? It's Reeves now. This is Admiral Patricia Corrigan, United States Navy Medical Corps. I apologize for the late hour, but what happened today requires discussion. Maya closes her eyes, pinches the bridge of her nose. There's nothing to discuss. I helped a patient, that's all. You performed emergency vascular surgery under crisis conditions and saved the life of a sitting governor. That's considerably more than helping a patient. Silence stretches across the line. Maya says nothing, has no energy left for deflection. Admiral Corrigan's voice softens slightly. Why did you leave the Navy, Commander? That's not relevant. It's relevant to me. I reviewed your service record this evening. 3 deployments, exemplary performance reviews, over 200 documented combat saves. And then you simply walked away, resigned your commission, disappeared. Maya's jaw tightens. I had my reasons. I'd like to hear them. Why? So you can try to recruit me back? Tell me the Navy needs me. No, because I'm trying to understand what we did wrong. What broke one of our best surgeons so badly she had to erase her entire identity to escape? The words hit like a physical blow. Maya feels tears threatening, blinks them back hard. I couldn't do it anymore. Do what? Triage. The word comes out raw. Choosing who lives, who gets the last unit of blood, who gets evacuated, and who stays behind to die. Her voice cracks. I was good at it. That's what made it unbearable. I could look at 3 wounded Marines and know instantly which one had the best chance, which one we should spend our resources on, which ones we should just make comfortable. She wipes her eyes with the back of her hand. And I was right. Every single time, I was right. The ones I chose lived, the ones I triaged out died, and everyone told me I was an excellent surgeon, that I had a gift, that I saved so many lives. But you couldn't forgive yourself for the ones you didn't save. I couldn't forgive myself for being so good at deciding who deserved the chance to live. Silence on the other end. D. When Admiral Corrigan speaks again, her voice carries deep understanding. Survivor's guilt, moral injury, the invisible wounds we don't talk about enough. I didn't want to be that person anymore, the one who plays God, who makes those calculations. So I became someone else, Dr. Maya Reeves. Yes, someone who could just practice medicine, save the people in front of her without having to choose between them. Without having to weigh the strategic value of one life against another, Maya stands, walks to her nightstand, opens the drawer. Inside sits the folded Navy Medical Corps patch. Beneath it, a photograph. She picks up the photo. 5 people in desert camouflage, covered in dust, exhausted but smiling. Maya stands in the center, younger then, her eyes harder. Forward Surgical Team Bravo, Kandahar, 2017. She touches each face as she speaks. Corman Garcia, killed by an IED 3 months into deployment. Rodriguez, one of our Marines, made it through surgery, died of sepsis a week later because we didn't have the right antibiotics. Lieutenant Kin, our anesthesiologist, helicopter crash, 3 days before we were supposed to rotate home. Her finger stops on the last person, a woman with dark hair and bright eyes, fierce smile despite the exhaustion. Lieutenant Sarah Vance, my best friend, my roommate through med school, the person who convinced me to join the Navy in the first place. Tears fall freely now. I was supposed to be on duty that night. 36 hours straight, I was dead on my feet. Sarah said she'd cover for me, told me to sleep. Her voice breaks completely. Mortar strike hit the surgical tent. Direct hit. Sarah was inside. She didn't suffer. That's what they told me. It was instantaneous. She sets the photo down with shaking hands. I should have been there. It should have been me. Admiral Corrigan lets the silence breathe for a moment before speaking, her voice gentle. Commander, you know that's not how it works. You can't choose when and where. I know. Intellectually, I know. But knowing doesn't make it easier to live with. Is that why you left? Why you changed your name? I left because every time I made a triage decision, I saw her face. Every time I chose one patient over another. I wondered if I was making the same calculation someone made about her. Whether she was worth saving or just acceptable loss. Maya sits back down on the bed. I couldn't carry that weight anymore, so I walked away. And today? Today I remembered who I was, what I can do, and I hate that it felt so natural, that my hands knew exactly what to do, that some part of me missed it. Admiral Corrigan's voice carries no judgment, only acceptance. The Navy would welcome you back. Your skills, your experience, we need people like you. I'm not coming back. I understand, but I want you to hear this. You did extraordinary work today, both as Commander Reyes and as Dr. Reeves. You saved lives. That's what matters. Not the uniform you wore or the name you used while doing it. Maya says nothing. One more thing. The Navy Cross recommendation from Chapman. You never accepted it. It's still in your file, pending your approval. I don't want it. Why not? Because I was just doing my job. Sarah would have done the same thing. Garcia would have. Any of us would have. We didn't do it for medals. We did it because people were dying and we were the only ones who could help. Admiral Corrigan's voice carries respect. That's exactly why you deserved it. But I understand. Good night, doctor. The line goes dead. Maya sets the phone down, looks at the photograph again. 5 people, 4 of them dead now. Just her left, carrying their memories, their loss. She lies back on the bed, still fully clothed, staring at the ceiling. Sleep. Ep won't come tonight. It rarely does. The faces are always there, waiting in the darkness. Rodriguez, struggling to breathe through failing lungs. Kim's empty seat on the helicopter that never returned. Sarah's locker, cleaned out by strangers because Maya couldn't bring herself to touch her things. The living carry the dead. That's the price of survival. The weight that never lifts. Outside, the city continues its endless rhythm. Inside, Maya lies awake, caught between 2 identities, 2 lives, neither of which sit quite right anymore. St. Catherine's Emergency Department, 7 in the morning. Sunlight streams through eastern windows. painting the corridor in shades of amber and gold. Day shift arrives with their coffee and determined expressions, ready for whatever comes. Maya walks through the main entrance. Word travels fast in hospitals. By now, everyone knows. Every nurse, every resident. Every janitor has heard some version of the story. The quiet ER doctor, who's actually a decorated combat surgeon. The woman who hid a war. She keeps her head down, moving through the hallway toward the trauma bay. People stop talking as she passes. Some stare openly. Others whisper behind raised hands. The attention feels like sunlight through a magnifying glass, burning and inescapable. A trauma bay doors swing open. Dr. Webb stands near the nurses' station with Nurse Jacobs. Both look up as Maya enters. The conversation dies immediately. Awkward silence fills the space between them. Webb clears his throat. Reeves. Webb. More silence. Webb shifts his weight, clearly uncomfortable. Finally, he steps forward. I owe you an apology. Maya stops, surprised. I underestimated you, dismissed you, disrespected you at every opportunity, and I was completely wrong. He extends his hand. What you did yesterday, both with the child and with Governor Kincaid, you are a natural hero. That was beyond extraordinary. That was the kind of medicine most of us will never be capable of performing. Maya looks at his offered hand, then back at his face, searching for insincerity and finding none. It was necessary, that's all. It was exceptional, and I'd be honored to work alongside you, really work with you as colleagues. She takes his hand. His grip is firm, genuine. Thank you. Nurse Jacobs approaches, her usual confidence replaced by visible discomfort. Reeves, I also need to apologize. The way I treated you, the dismissive comments, assigning you menial tasks because I thought you were just coasting by on an easy position. She meets Maya's eyes directly. I should have respected you, regardless of what I thought I knew about you. You deserved better. Maya nods slowly. You didn't know, none of you did. That's not an excuse. Respect shouldn't require justification. Before Maya can respond, Leon appears from the hallway, still in his security uniform, his posture military straight. Doc. Maya turns. Something in his voice carries weight. I knew, from the beginning. A small smile touches Maya's face. I know you did. Leon steps closer, his voice low and sincere. For what it's worth, you had my respect from day one. Didn't need the uniform or the rank to see who you were. He nods once, a gesture that carries meaning beyond words, then walks away, back to his post. Maya watches him go, feeling something warm settle in her chest. Acceptance, recognition. Not for what she did, but for who she is. The overhead PA crackles. Dr. Reeves, please report to the administrative office immediately. Webb and Jacobs exchange glances. Maya takes a breath, straightens her shoulders, heads toward administration. The administrative wing sits quieter than the clinical areas, carpeted hallways absorbing sound. Maya enters the main office. Garrett Nils waits inside, along with Dr. Henderson. On, Chief of Medicine. Henderson gestures to a chair. Dr. Reeves, please sit. She sits, back straight, hands folded in her lap. Old habits returning without conscious thought. Henderson leans forward, his expression serious. First, I want to personally apologize for the board's decision regarding the trauma director position. We made a judgment based on bias and assumption rather than competence and qualification. It's in the past. It's not acceptable. We failed you, and more importantly, we failed our patients by not recognizing the resource we had. He slides a folder across the desk. We'd like to offer you the position of trauma director, effective immediately, with a substantial increase in compensation and full authority over trauma protocols. Maya stares at the folder, not touching it. What about Dr. Webb? He's already agreed to step down. In fact, he recommended you personally. He believes, and I quote, that you're the most qualified trauma surgeon he's ever witnessed in action. Nils speaks up, his voice carrying both respect and something that might be embarrassment. When Commander Halford revealed who you were yesterday, I thought there'd been some mistake. I'm ashamed to say my first instinct was disbelief rather than appreciation. He pauses. Thank you for trusting us enough to reveal the truth, even when circumstances forced your hand. Henderson continues. We're also implementing new protocols. The Reyes Protocol. Any physician, regardless of rank or seniority, can call for immediate trauma escalation without requiring approval from supervisors. No more hierarchy blocking critical decisions. Maya opens the folder slowly. Contract, new title, salary figure that makes her blink. Authority to restructure the entire trauma department. I need to think about this. Of course. Take whatever time you need. Maya stands, folder in hand. Actually, no. I don't need time. She picks up the pen lying on the desk. Signs her name on the contract line. Maya Reeves, not Reyes. That part of her life remains in the past where it belongs. I accept. Henderson smiles, genuine relief crossing his face. Welcome aboard, Director Reeves. Maya walks back toward the trauma bay, the signed contract feeling heavier than it should. This means staying, committing. No more hiding behind routine cases and discharge summaries. This means being visible, being known, being the person everyone will look to when everything goes wrong. The ICU sits one floor up. Maya detours, checking on her patients from yesterday. Professional responsibility, she tells herself. Not avoidance of the attention waiting below. Governor Kincaid's room is third from the nurse's station. Security posted outside nods as she approaches. Inside, the governor sits partially upright, intubation tube removed, oxygen cannula in his nose. His color has improved dramatically. He's alive. He'll stay that way. He sees her, gestures weakly. You're the one. His voice comes out hoarse from the breathing tube, but clear enough. Maya approaches the bedside. How are you feeling, Governor? Alive. Apparently that's thanks to you. Just doing my job. Kincaid manages a weak smile. They told me who you are, what you did. Navy surgeon, combat veteran. He coughs, winces at the pain in his chest. My son served in Afghanistan, Marines. He came home different, wouldn't talk about it. His eyes find hers, understanding passing between them. Thank you for your service, both there and here. Maya nods, throat suddenly tight. Rest now, you need to heal. She turns to leave. Doctor, she stops. Kincaid's voice carries quiet determination. I'm going to make sure everyone knows what you did. Not just for me, but for all of us. The way you've been overlooked, underestimated. That changes now. Ow, Maya's face remains neutral. That's not necessary. Yes, it is. People like you shouldn't have to hide what you're capable of. The world needs to know there are people like you out there, doing the work nobody else can do. Maya doesn't respond, just continues out of the room. His words follow her down the hallway. Recognition, visibility, the opposite of everything she's wanted for 6 years. But maybe that's not her choice anymore. Maybe the secret was never really hers to keep. She returns to the trauma bay. The day continues. Patients arrive. Minor injuries, nothing critical. The staff treats her differently now. Deference where there was dismissal. Respect where there was contempt. It should feel like victory. Instead, it feels like loss. The quiet life she built is gone. The anonymous doctor, who could blend into the background, has been replaced by someone people will always be watching, always measuring against impossible standards. By afternoon, the hospital grapevine has spread the story even further. Residents approach with careful questions. Nurses mention family members who served. Even the cafeteria staff treat her with new courtesy. Maya accepts it all with practiced neutrality, answers when appropriate, deflects when possible, maintains the careful walls even as everyone tries to see through them. This is her life now, visible, known. The combat surgeon who tried to disappear and failed, the woman caught between two identities, forced to reconcile who she was with who she tried to become. As evening approaches, Maya stands at the window overlooking the parking lot, watching the shift change, people coming and going, lives intersecting briefly in this place of crisis and healing. She touches her left wrist, that small scar hidden under her watch. The reminder that used to ground her in this new life now just connects her back to the old one. Maybe that's okay. Maybe both versions can coexist. Commander Reyes and Dr. Reeves. War and peace. Past and present. Maybe she doesn't have to choose anymore. 6 months later, St. Catherine's emergency department has transformed in ways both visible and subtle. New signage near the main entrance reads, Reyes Trauma Center, in brushed steel letters. The board fought her on the name. She'd insisted on Reeves. They overruled her, said the name Reyes carried the weight of what she'd done, who she'd been. Said it honored both identities. She stopped arguing after a while, learned to pick her battles. The trauma bay hums with controlled activity. Maya stands at the center, surrounded by 6 residents in fresh scrubs, their faces eager and attentive. Teaching rounds. Tuesday morning ritual. In trauma, your instinct screams at you to rush. Fight that instinct. Slow is smooth. Smooth is fast. Panic kills more patients than injuries do. The residents scribble notes. One, a young woman named Chen, raises her hand. Dr. Reeves, how did you stay calm during combat situations, when everything around you was chaos? Maya pauses, considering the question with the seriousness it deserves. I didn't. Not at first. I was terrified every single day. Thought I'd freeze up, make a critical mistake, get someone killed. She leans against the exam table. Her posture relaxed now in ways it never was 6 months ago. But I had people depending on me. Marines bleeding out. Corpsmen looking to me for answers. So I learned to breathe through the fear, to trust my training even when my hands wanted to shake. She looks at each resident in turn. You will be scared. That's normal. That's human. Fear keeps you sharp, keeps you from getting complacent. Just don't let it paralyze you. Don't let it stop you from doing what needs to be done. A trauma alert sounds. Everyone's head turns toward the speaker. Incoming, 29-year-old. Old male, construction accident, penetrating injury to abdomen, vitals unstable, ETA 3 minutes. Maya straightens. Let's go. Chen, you're primary on this one. Talk me through your approach. They move as a unit toward the ambulance bay. The residents fall into practiced positions, no longer the chaos of 6 months ago. Maya's protocols have taken root. The Reyes protocol especially, the one that lets anyone call for escalation without approval. It's saved 4 lives already that might have been lost to hesitation and hierarchy. The ambulance arrives, doors open. Paramedics transfer the patient with efficient urgency. Chen steps forward, voice steady despite her obvious nerves. Primary survey, airway patent, breathing labored, circulation compromised, 2 large-bore IVs, type and cross, fast scan to assess for free fluid. Maya watches, doesn't intervene. Chen's hands work steadily, methodically. The patient stabilizes. The bleeding is controlled. Surgery is called. The man will live. Good work, Maya says quietly as they wheel him toward the OR. You trusted your training. Chen's face flushes with pride. Thank you, Dr. Reeves. A nurse approaches with a tablet. Dr. Reeves, the 8-year-old from the pileup 6 months ago. Michael Patterson, he's being discharged today. Final follow-up. Family asks if you could stop by. Maya's expression softens in ways it rarely does. Tell them I'll be there in 10 minutes. She turns back to the residents. That's why we do this work. Not for recognition or glory. For moments like that. For the knowledge that someone gets to go home because you refuse to give up on them. A different resident, Ahmed, raises his hand. What about the pregnant woman from that same day? Did she recover fully? Maya smiles, a genuine expression that transforms her usually serious face. Healthy baby boy. Born at 35 weeks, mother had some complications but recovered completely. She named him Leon, actually, after our security guard who helped that day. The residents exchange glances, smiling. These stories matter. These outcomes justify the exhaustion, the stress, the weight of responsibility. The day continues with its rhythm of crisis and calm. Minor injuries treated and released. A cardiac event stabilized and transferred to the catheterization lab. A diabetic emergency corrected before it became critical. Routine saves that still mean everything to the people receiving care. By late afternoon, Maya finds herself on the roof of the hospital, a place she's claimed as her sanctuary. The city spreads below, endless in its complexity and motion. Sirens wail in the distance. Life continuing, people living and dying and struggling and surviving. Her phone buzzes. Text from Commander Halford. Governor Kincaid is doing remarkably well. Returned to full duties last month. He's speaking at a Veterans Healthcare Conference next week and wants to know if you'd be interested in attending as his guest. Maya considers the message. 6 months ago, she would have deleted it immediately. Would have hidden from any public recognition. Now she types back. Tell him I'm glad he's recovered fully, but I'll pass on the conference. Not my scene. Give him my regards. She pockets the phone. Some things don't change. She still prefers the work to the recognition. Still finds more meaning in the quiet moments than the public ones. Another text arrives almost immediately. This one from Leon. Doc, Coffee in the break room if you want. Figured you could use a break. She smiles. Leon has become an unexpected friend, one of the few people who knew her before the revelation and treats her exactly the same after. No pedestal, no special treatment. Just respect between two people who've seen the worst humanity offers and chose to stay human anyway. Be right down. The break room sits quiet, late afternoon lull between shifts. Leon pours 2 cups of coffee, hands her one. They sit in comfortable silence for a moment. You did good, Doc, these past 6 months. Heard the trauma survival rate is up 18% since you took over. Maya shrugs. Better protocols, better training. It's not just me. It's you, don't minimize it. She sips the coffee, lets the moment settle. How's your grandson? The one who was thinking about enlisting? Decided on college instead. Engineering. Think you had something to do with that. I just talked to him. Told him there are lots of ways to serve. You told him war changes you in ways you can't undo. That peace is harder to find than people think. Leon meets her eyes. That meant something, coming from you. They sit together, 2 veterans in a civilian world, connected by experiences most people can't understand and don't want to imagine. The evening shift begins filtering in. Maya finishes her coffee, stands. Back to work. Always is with you. She returns to the trauma bay. Another alert comes through. Motorcycle accident. Critical injuries. She moves into position, her team assembling around her with practiced efficiency. This is her life now. Not the quiet anonymity she'd planned. Not the invisible existence she'd built. Something harder. Something more honest. She's still Maya Reeves. Still the woman who wanted to practice medicine without the weight of war. But she's also Commander Reyes, the surgeon who knows what it means to make impossible choices under impossible conditions. Both truths exist simultaneously. Both identities matter. The patient arrives, young woman, early 20s, massive trauma. The kind of case that would have paralyzed the old team. Before the protocols, before the training, before Maya showed them what's possible when you refuse to accept inevitable death. Let's go, people. She's not dying today. Her hands move with absolute certainty. Her voice carries calm authority. Around her, the team responds with coordinated precision. This is what she's built. Not just better medicine, but better practitioners. People who trust themselves because she taught them how. The woman stabilizes. Surgery is called. The prognosis is cautiously optimistic. Another life pulled back from the edge. Maya strips off her gloves, washes her hands with familiar ritual. In the reflection of the window, she sees herself. Older than the combat surgeon in that photograph. More tired, but also more complete. The fractured pieces finally forming something whole. The board said women couldn't handle trauma. Said it required aggression, instinct, qualities they assumed she lacked. They were wrong. Not because she proved she could be aggressive, but because she showed that trauma care requires something else entirely. Requires calm under chaos. Requires competence over confidence. Requires the wisdom to know when to act and the courage to do what's necessary, regardless of cost. Outside, the sun sets over the city. Another day ending, another night beginning. The endless cycle of emergency medicine, of human crisis and human resilience. Maya Reyes stands at the window, watching the light fade. She doesn't smile, doesn't celebrate, just exists in this moment, this life she's claimed despite everything. Some people are meant to save lives. It's not heroism, it's not glory, it's just what they do, who they are. She turns from the window, returns to her patients, to the work that never ends. This is enough. This is everything. The story ends not with triumph, but with continuation. With the quiet knowledge that tomorrow she'll return and do it all again. And the day after. And the day after that. Because people need saving. And she knows how. That's all that matters.